Mine, I think, is not an easy task, but let me tell you that you've excited me. I'm very excitable when it comes to primary health care, yeah? But what I heard today is an aligning of the thinking. USAID on one hand, World Bank on one hand, WHO on the other hand. And I think we have not been there for a long time. And for me, that is very exciting. The fact is that health systems were in crisis and broken well prior to COVID-19. COVID-19 showed up the fact that we had not sufficiently developed our healthcare systems. Because, in fact, we've paid lip service to primary healthcare, beginning with Alma-Ata, going on to Astana, to UHC and UNGA. Forever we have given lip service. And I keep wondering, do we have the right people in the room? And so I was very happy to hear that in the World Bank that they are speaking to ministers of finance about primary health care. And right now we need to take that discourse to our heads of states, because if you saw during COVID-19, they took the helm. And so they must take the helm for the radical transformation of our health systems based on primary health care. So let me say that primary health care is the bedrock for anything that we can do in terms of universal access to health, universal health coverage, the SDG, attainment of SDG goals, all of those things, and for human development. And so I'm going to run through a few things that are absolutely necessary. I heard some of you say, the investments. There must be increased investments in health. Where's the 15% in the Abuja Declaration? In PAHO, 6% of GDP. And how is that money being divided for primary health care? In the Americas, we passed a 30-30-30 declaration that 30% of the public resources available for health must go to primary health care, and that 30% of those barriers must be removed by 2030. Unless there is significant investments going to primary health care, we are not going to make it. Unless we have financing mechanisms that will ensure that people have access to care free of payment at point of service, we will never get there. We have to reduce significantly, almost to zero, our out-of-pocket payments. And we have to invest in a meaningful health workforce. So far, I can say all countries here, we have invested significantly in the development and training of healthcare workers for our tertiary and secondary institutions. Not much for primary healthcare. Many of you have relied on community health workers that are poorly trained and poorly remunerated, and we rely on them. But where is the workforce for primary health care? How are you working with your education systems to make sure that you have primary care physicians that understand the community, that you have nurses and other categories of healthcare workers around primary health care? If you're not doing that, we're not here then. How are you going to invest in the referral systems that are necessary? Telehealth, telemedicine, and all of this digital transformation that must take place. Really, where it is needed, beyond client care management, is at the primary healthcare level. And so how are you getting engaged in digital transformation for primary healthcare? And let me say that then there needs to be really an investment in essential public health functions. And I heard the minister from Jamaica, because their primary healthcare was so engaged in detecting, reporting, and responding to COVID-19, they were better able to respond at that level. And where's the investment in equipment and supplies? We talk about quality of care. You can't have quality of care unless you have the tools to work with. Basic point of care testing. Where is it? Unless we are able to increase the possibility or the capability of primary health care to deliver quality services, our people will continue to bypass primary health care and go to the hospitals where cost is so much more expensive. And for time, I can speak for hours on primary health care, but in terms of meaningful community engagement, there is no primary health care if it's not people-centered, and if communities and people are not at the very center. And you remember, maybe I'm too old because I'm in this business on primary health care since 1980. we had village health committees. I'm not advocating that we go back to village health committees, but can we find something where communities will be at the very center, sitting at the table with our healthcare workers and the healthcare decision makers, so their own needs can be expressed and that they can be part of the solution? And I have one last thing to say. I'm sorry that Tedros is not there, but Susanna is there. Until WHO can truly integrate all of its siloed programs on a primary healthcare lens, we will never get there. Because WHO is the one that interacts with ministries of health. And if the vision is not really entrenched in WHO as to how we integrate all of those vertical programs into a health systems approach, we will never get there. Gates has moved from, I'm not interested in health systems and healthcare delivery systems, to being interested. USAID is moving from vertical programs to a much more transversal approach. World Bank as well. We must all align. And really very, very important is what will happen in WHO. I have been there before. I was in WHO.
Thank you so much.
In 2008, I was the ADG that worked on health systems.
Thank
Unless
you so
it happens
much,
there,
Doctor.
never
Thank you
happens.
for those brilliant remarks. Thank you all so much. We appreciate it. Thank you to our panelists, and thank you to you all. Thank you so much.